Looking at this artificial foot, this is the heel bone. Here are the lengthwise tendon and foot, and here's the tissue attaching the tendon to the heel bone. Plantar fasciitis is an inflamed condition occurring through excessive stress of the tissue which keeps the foot's lengthwise tendons attached to the heel bone. If this excessive stress is happening over an extended period of time, it is possible that microscopically healing of the wounds in the tissue may form a calcium deposit on the heel bone. This calcium deposit is in the medical profession known as a heel spur. On this artificial skeletal foot, we can here identify the heel bone where the heel spur may develop. Today the term heel spur is commonly used for plantar fasciitis as well as for the real heel spur. The majority by far, however, of the pain problems in the heel comes from plantar fasciitis. In other words, an inflamed condition in the tissue attaching the lengthwise tendon to the heel bone, and this is regardless of whether or not there is a shadow from a real heel spur on an X-ray photo. The pain will, in most cases, be starting from the heel, moving forwards towards the front of the foot. As can be seen, the tendons are fixed in a semicircle around the heel bone, resulting in possible pain up along the heel through excessive stress. The pain may even spread up along the foot and to the Achilles tendon and up to the top of the foot. Compare this to the great pain many people experience in the morning taking the first steps when getting out of bed. Consequently, the pain originates from excessive stress of the tissue which binds the tendons to the heel bone. The reason being, the lengthwise tendons are not sufficiently elastic. Applying excessive stress to the foot may result in the tendons pulling the tissue hard enough for the damage to occur due to insufficient elasticity. In other words, the generated stretching of the tendons will create damage to the tissue. But why does this lack of elasticity occur in these tendons? Walking barefoot directly on hard and uneven surface was what we were originally meant to do. Under such circumstances, the foot must be moving constantly in relation to the underlying surface. The lengthwise tendons in the foot will through this movement achieve a very high degree of flexibility. Nowadays, we walk on level surface with good cushioned shoes. The level surface and the cushioned shoes will reduce the movement of the foot's lengthwise tendons compared to the natural extensive movement of the foot had the foot been directly against the uneven surface. Limited movement of the tendons will automatically generate tendons with less elasticity. We know about the problems occurring with inactive tendons and muscles in connection with a broken arm. After having had the arm in plaster, it is afterwards necessary to expose the tendons and the muscles to a long training regime before the elasticity of the tendons has returned to normal. If the foot's lengthwise tendons are inelastic, only a small overload is necessary for pain to be released in the heel. Many sports people, as well as recreational runners, are also bothered by pain in the heel, coming from plantar fasciitis, even though they may feel they are moving the foot. That is, of course, what they do. However, when using sports shoes while running, the foot is exceptionally well protected through the external shock-absorbing sole. Inside the shoe, the foot will be in a fixed position as intended by the foot-formed insoles. This is necessary in order to protect the foot against large amounts of stress during sports movement and in order to create the desired acceleration. Due to the protection of the foot through the outside sole as well as the fixed position of the foot by the foot-formed insoles, the lengthwise tendon do not achieve the same degree of training as do the rest of body's muscles. This may easily result in damage to the tissue in the heel when running long distance or executing big jumps. The aim with the MEDICOVI insole is to increase the elasticity of the foot's lengthwise tendon through training and hopefully making the problems in the heel go away altogether. This is being achieved by using water in the soles. The lightning-fast movement of the water will be creating pressure waves, and this will cause an ongoing provocation of the foot's lengthwise tendon, forcing increased movement in the shoe. In layman's terms, we transplant the natural movement of the foot to the inside of the shoe. The MEDICOVI Twin-heels are a combination of a sensory water-filled massage sole with an underlying welded-on and patented water-filled heel protector. The patented water-filled heel protector provides a great amount of shock-absorbing and ongoing pressure relief. The heel protector is designed to allow an overpressure in the chamber under the heel. A small amount of water is being pushed up in the spring element when the heel is being pushed downwards into the heel protector, but always allowing a protecting water cushion under the heel. With the heel protector, a large amount of shock absorbing is achieved as well as a continuous pressure relief of the heel, with a water cushion always adapting to the heel bone. The heel protector is welded to the sensory water-filled massage soles by means of 6 weldings. There is water in the sensory massage sole. This is necessary if we want to achieve the desired flexibility in the foot's lengthwise tendons. Water is the only liquid flowing fast enough to achieve a continuous provocation of the movement of the foot every time there is just a small change in the position of the body's center of gravity. The water's reaction is fast enough to provoke a new movement of the foot, even with the smallest change of the load. The water in the soles is therefore creating an ongoing provocation for the foot's lengthwise tendon to move, even with the total body weight resting on the foot. In layman's terms, we transplant the natural movement of the foot's lengthwise tendon from the uneven surface to the inside of the shoe. Where the movement in the nature is influenced by hard stones, the movement through the sensory water-filled massage soles will be perceived as a continuous and pleasant foot massage, which at the same time will be increasing the blood circulation. This combination of shock-absorbing and dynamic pressure relief of the heel, together with the ongoing and persisting training movement of the foot's lengthwise tendon, will usually create a fast improvement of the heel problem. The MEDICOVI Twin-heels will simultaneously provide a relatively large relief of the forefoot through the movement of the water. This will all the time bring about a change in the load of the ball of the foot and thereby reducing the pressure around pain-generating areas. The soles comes in 2 sizes, and the toe end of the sole can be adjusted for length. A size 41 can therefore be cut to fit a size 40. This is done by using the scissors in this way. The tip of the sole can also be removed if there's not enough space for the toes, for instance in the case of hammer toes. The MEDICOVI Twin-heels are 2 mm thick at the front and approximately 4 mm in the heel, where the patent heel protector is. The advantage with the MEDICOVI Twin-heels is therefore that it will fit inside almost any shoe, which is very important. It is the constant relief of the heel combined with the ongoing increased movement of the foot's lengthwise tendon which will increase the flexibility of the tendons. This is necessary for a solution to the heel problem.